Welcome back to the EIU podcast series on what do young urologists need to know. This is segment 3, where we discuss how to pursue academic excellence in urology. In this episode, we are joined by Dr. Luca Afferi and Associate Professor Giorgio Ivan Russo. Together, they will provide insights into the art of writing the urology abstract, guiding you from the initial idea to publication. Join us as we embark on this informative journey.
Hello, everyone, and welcome to the podcast organized by the Young Academic Urologists. My name is Luca Afferi. I'm a urology resident from Switzerland, currently working as fellow in uro-oncology at Fundació Puigvert in Spain, and I'm also chairman of the European Society of Residents in Urology. Here with me today as our guest, we have Professor Giorgio Ivan Russo from Italy. He is associate professor in urology at the University of Catania, and of course, an expert in the topic that we will address today. That is the art of writing urology abstracts from idea to publication. Welcome, Giorgio.
Welcome to everybody, and thank you, Luca, for this kindly invitation.
Thank you for being here today. We will directly start with the first question, which in my opinion addresses specifically the topic. Where is the art and where is the science behind writing an abstract?
So it's very interesting to start by the end. When we produce an abstract, obviously it's the last part of our scientific activity. But it's important to say, as you said, that is art inside the writing of the abstracts for many reasons. But the first reason is because we have to deliver the message to our scientific societies, to our colleagues, to our urologists. But most of the time nowadays, it's very interesting also to deliver the message to the common population, so normal people. So the art is just mixed with scientific data, but it is important when we write an abstract is to deliver our message. So first of all, we have to take into mind what we want to say to our colleagues, and it is based on what we have found in our research, in our clinical practice, and obviously in our data. So take into mind to have very clear idea, very specific topics and very specific messages, then we can write the abstract. But obviously it's not only just reporting data, reporting percentage, and reporting statistical analysis, because the abstract should be very easy to read, should be attractive, it should be interesting for the reader. So we have to mix, obviously, scientific data, numbers, but also with some kind of artistic way of deliver the message. So first of all, the title should be captive and should be very attractive. Moving just into the deep part of the abstract, and then the conclusions, for example, of the abstract should be very clear, very strict, and should be obviously homogeneous with the aim of the abstract itself and our scientific activity. So we have to improve our knowledge, we have to improve ourselves in writing, and also to ask someone to read the abstract in order to make corrections and be the definitive abstracts.
Well, thank you very much. I think you addressed a very important point. So if you allow me to summarize the main elements of what you said, science is the very start. We start with an idea, we start with the concept, and then when it comes the moment of writing down the abstract itself, we need to make sure that everybody will understand it and it will be, of course, attractive. In your opinion, how it is the best way to formulate the scientific idea behind the abstract?
So first of all, I think we have to observe our clinical practice. I think that the scientific activities is a second part of our clinical practice. Obviously, for example, I don't treat almost renal cancer. I know as urologist, I can treat renal cancer, but we don't have in our institution a very amount clinical data on renal cancer. So the scientific ideas, in this case, for example, very poor. But on the contrary, for example, I used to treat lots of patients with infertility and BPH. So normally, when I just address clinical practice, clinical patients, when I came back home, I have some questions, or also sometimes there are questions from the patients that I cannot answer. So I think that the scientific activities is really secondary to the clinical practice, because we have to answer and to address specific missing of the scientific data nowadays. And so the right idea to formulate is to start from the clinical practice. What the science is missing, we can cover this missing data, this missing, for example, efficacy of a treatment, of a specific part of the diagnosis, of the epidemiological part of any kind of disease. And then we can just formulate the right idea.
Okay, thank you very much. So the question really comes from what we experience every day in the clinics, and ideally it should have an impact on the clinical practice, right?
Yes, you're right.
And once you have the idea, how do you turn it into a project?
Yeah, so most of the time we don't have brilliant idea. When we have a question in our mind, then obviously it's really easy to check on PubMed, because most of the time there are other colleagues that have done or have replied to the same question. But every time we produce a scientific article, there is always a limitation of that article that is addressed by the authors themselves. So we can start from the limitations of the other studies in order to start a new study, and also to move forward and to cover other missing data or other missing questions on the same topic. Obviously, if for a specific topic there are amount of data on that, maybe we move to another topic. But I don't think that ideas are bad in all the time. Every idea is a very good idea. I think the best way to move forward from idea is to design a proper clinical studies. And most of the time we can, for example, increase the number of subjects included in the studies, because many articles that are in the literature, they can cover, for example, 200 of patients. They have a retrospective design, just improving these aspects, improving the number of patients, or just modifying the design of the study. These are important aspects of producing a very good quality of article on that specific idea. So first of all, in summarizing, we can check on PubMed, we can check the most specific and the most famous article on that topic, check the limitations, and just see if we can address the limitations by producing a new scientific project.
Thank you very much, and also for this nice summary. So keywords, look into existing data and check limitation and try to imagine how you can improve the existing literature. But how do you obtain the data? This is one of the most difficult parts of doing research.
Yeah. So obviously, if you belong from a very important institution, they have a clinical data manager. But we will not discuss about this, because this is very easy, and obviously it should be the most important way to collect data. But first of all, as I said before, we have to check about what we can do from our clinical practice for the community. If we have a lot of patients affected by infertility, for example, we can assess these patients because we will have a lot of data. It's important to construct a very easy to read and also easy to share database. And I think it's important to collect very clear and important variables. It's not important to collect hundreds of variables, because the more variables you include, the more time you need in order to collect the database. Obviously, it could be helpful to obtain help from the residents, from a very young colleagues and young consultants, because doing the job alone is very difficult. We can collect all the papers from the patients from Word and then translate into the Excel. Or if we use a software from our institution, we can obviously download that. Most of the time in my clinical practice, I do phone calls for the patients. Can be, for example, wasting time sometimes, but it's very useful because patients, they are abroad, they are far from our institution, they cannot come back in order to deliver information. And having a very good relationship with patients, it can be helpful because we can call the patients asking for some information. For example, if we are in a very good shape, for example, the therapy is working, they have not recurrence for cancer, for example, and then we can collect our database. I think that collecting database day by day is much more efficient than collecting 500 of patients in an afternoon or in a week. Every day, 2-3 patients per day, it's working in order to have, by the end of the year, a very huge amount of data.
Yeah, these are all important things to remember. If you do a collaborative work, you always need to think that on the other side, there will be other residents or fellows who will collect the data. And if you put too many variables to collect, then it's going to be difficult on the other side to keep concentrated for the whole work. Maybe on the other side, there will be no interest in filling all the variables. I think these are all important elements to remember.
If I can add something, for example, the congresses, the YAO congresses, the European Congress, is crucial not only to listen for eminent speakers, but also to create our network. Just learning into a specific section, for example, the andrological section of the robotic section, you can stay with other colleagues that deal about the same topics, and then we can share ideas with them, create our network, also collaborate with them with their idea, but just constructing our network will improve our capacity to perform by our own in the future our own scientific projects. And so congresses are really important to improve networks and to share ideas or to improving the points itself.
Yeah, definitely checking with people who are more expert than us about that specific topic is crucial. I also think that if you want to share a database for variable collection, you should have it first checked from someone with more experience than you. And let's move now to the next question. Once you have the data, then it will come the moment that you will have to analyze them. Many fear this part because most residents in urology or most urologists feel that they'll have the right competence to do statistical analysis. In your opinion, what's the needed statistical competence to write an abstract?
So this is very hard part of writing the abstract and then the article, and you are totally right. I do a lot of mistakes normally, but I do perform the statistical analysis, for example, on my own. And I started alone. And if I can suggest something, I suggest to read a lot of articles. Obviously, we are in the family of European Urology. It's a very eminent journal. There are a lot of journals like Lancet, like JAMA. So very important journals and articles. We have to read them. When we read an article, I think we can concentrate on the statistical analysis and at first, so very, very few points. It's not important to read into the deepness of the article. But when we check, for example, the efficacy of a treatment or a medical therapy for a specific topic, for a specific variable, then we can check only that part, that statistical part. We can see what the authors have done. And then we can, for example, writing our draft or something and see what they have done, and then we can do the same. So if we have, for example, a specific analysis to do, we can read the other articles, see what they have done. And for example, if we have to do a t-student or a chi-square, then we can do the same test. How we can do the test if we are not able to do the test? There are a lot of software, normally SPSS, R, Stata, there are so many. But on YouTube, there are very interesting videos from statistical experts that can help in the specific software how to do that test. So if we have in our mind, which test we have to do, then we can check, for example, on YouTube how to perform on that software, and then we can learn how to do it. Most of the time, the more time you do the test, then you will have automatically how to perform that. And obviously, if we have a specific mentor or a consultant that can help us, it's very much more easy to perform a very good statistical analysis. But on YouTube, I think there are a lot of tutorial, and we can watch on that tutorials.
Yeah, I think you're right, Giorgio. There are many tools out there that can help us to do our first statistical analysis. And I know if you agree with me, but in my opinion, quite often you don't need the very fancy statistical models or concepts for your very first works.
Yeah, you are right. Very simple analysis, very well done and specific. And then we can answer our previous question on why we are performing that study. And most of the time, as urologists, we can use simple tests in order to have a good message for the scientific community.
So now it's about the time to wrap up. And I have a very last question for you that I think would be very, very helpful for those who are listening to our podcast. If you would like to give a single advice to someone approaching research for the first time, what would you say?
I think that the single advice is that we have to change our clinical practice, and also we have to improve our clinical practice. So first of all, we have to observe our reality, our common clinical practice. And then from that, we can start in performing our scientific tests and scientific projects, because little by little, step by step, we can change our scientific community, ideas and clinical practice, and as urologists, urological disease, steps by step.
Well, thank you very much, Giorgio. This was a very nice conversation, and I think that everybody will take advantage of all your insights.
Thank you so much, Luca, and thank you to all for listening to us. Thank you so much.
Thank you. Goodbye.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.